and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today is Margie Prop. Thank you, Margie, and thanks to everyone for joining us. We're here today to share some important information about updated COVID-19 booster doses and announce upcoming vaccination clinics. Recently, the CDC approved updated boosters for everyone 12 and older. Over time, COVID-19 has evolved, and now so have vaccines. These updated boosters do two things. They provide protection against the variants in our community right now, like BA4 and BA5, and they boost the body's immunity against COVID-19. COVID is still with us, and there's potential for an increase in infections this fall and winter due to people spending more time indoors where respiratory viruses like COVID can spread more easily. And waning of immunity from vaccines or prior infections is a concern. More than 74% of COVID-19 cases in Lancaster County over the last month have been in people who aren't up to date on their COVID-19 vaccines or who are unvaccinated. We encourage people who are eligible to get an updated booster, and we strongly encourage anyone 65 and older to do so as soon as possible. The updated booster better protects against severe illness, hospitalizations, and death from COVID, and will help us continue to conduct our daily lives with a sense of normalcy. Joining us today is Dr. Kevin Richmond. He is a pulmonologist who has provided critical care to patients throughout the pandemic. He'll provide more details about the updated boosters from a physician's perspective. Dr. Richmond?
Thank you, Director Lopez, and it's a pleasure to be here again. I think it's, as Director Lopez said, truly this is an ongoing battle, and we have to adapt just like the virus has adapted. And part of that adaptation is continuing to look at countermeasures. And I think back to the first time I was here when we had no vaccinations. We really didn't have great preventive or proactive therapeutics. We had the things we could do once somebody ended up in the hospital, but now we have quite a number of things that have really helped. But that said, still the best way is for us to prevent the disease and certainly prevent serious illness. And so with the vaccination, as Director Lopez says, and this is what I see in our practice, both hospitalization and outpatient management of these patients, is that by far, those patients who are unvaccinated or not up to date, and I think, we definitely have learned the vaccination's not perfect. It doesn't prevent all disease or, all infections, but it still does an excellent job of preventing serious illness and especially hospitalization. If you look at the current data, 14 times more likely to die, and you can look at similar numbers for hospitalization if you're unvaccinated. If you're not up to date, about 3 times more likely to die. So clear evidence that the vaccination does the things that are most important. And so with that, I would encourage everybody to look at themselves and their families and see where they're at in that category. If you're not vaccinated, get vaccinated. So that's still with the primary series. And if you're not up to date, if you haven't had a booster, this is a great time to get the booster because this bivalent vaccination is now approved. And so it's tailored to the original strain as well as this BA4-5. And the data shows excellent immune response improved from the original monovalent strain. And what we see, as Pat said, is that over time, immunity wanes, whether that's from vaccination or infection. And so this is part of that preventive strategy, is to try to give that immune system a boost and continue to provide the protection. The patients I've had in the hospital over the past several months, I would say I don't think I've had anybody that truly was up to date with their vaccinations myself. And I think the other thing that we have to remember is that, and I definitely see this in my clinic as well, is that I don't see the long COVID, and the data bears this out. There's a reduction in long COVID type symptoms in those who are vaccinated and happen to get the disease compared to those who are not vaccinated or up to date. And so I think this is a great opportunity, and I thank Lincoln and the Lancaster County community for everything you've done throughout this. And we are going into a concerning time as it relates to the fall and winter. I hope we can maintain kind of at least where we're at, if not better. But this is a great time to put yourself and your family, your loved ones, in a position to be protected. We have vaccinations for a reason. This is the time to start thinking about your influenza vaccination, because we know flu season's coming. Australia certainly had a rough flu season in that part of the world, and so we're worried about that. And so let's do everything we can to make sure we're as protected as we can from all the things we have preventive measures for, such as influenza and COVID, and take a look and get this updated booster if you're eligible. Thank you.
Thank you for taking time to be here today, Dr. Richmond. People can receive an updated booster dose if it's been at least 2 months after their last booster or since completing the primary series. The health department will be providing updated booster doses by appointment only at 2 larger clinics later this week, starting with people age 65 and older and people who are immune compromised. This is based both on the increased risk COVID poses to older adults and those with weakened immune system. And on the current vaccine inventory will be used to look at this. We'll be using an approach similar to the initial rollout of COVID-19 vaccine, moving through age and priority groups and stages. The first clinic is on Friday, September 16th at Northeast High School from 4 to 7. And on Saturday, September 17th, we'll be back at Northeast for a second clinic from 7:30 to 11 a.m. We're currently contacting people in those age groups by email or phone to schedule an appointment for their updated booster. We expect to receive additional vaccine both this week and next week, and we'll be announcing additional clinics and age groups as soon as we can. We're also working with local pharmacies to provide these safe and effective updated boosters to long-term care facilities to help protect some of the most vulnerable members of our community. Many pharmacies are offering updated boosters by appointment to anyone eligible to receive one. Go to vaccines.gov to find a pharmacy near you. I tried it out today, and simply enter your zip code and you'll see what's available. Receiving the primary series so you have that initial protection against COVID-19 is still important. Children under the age 5 were the most recent group to become eligible for the primary series. We continue to work with partners to help parents get the information they need to make the best choices for their children. And we strongly encourage parents to vaccinate their children. And if they have questions, reach out to a healthcare professional or other trusted resource. We have clinics for this age group every week at the health department, and you can find upcoming clinics on our website or by calling 402-441-4200. Vaccines are one of the tools that will help us stay healthy and manage the virus moving forward, as Dr. Richmond said. Currently, our local situation is holding steady, and the risk dial will remain in elevated yellow for the 4th week in a row. Cases decreased slightly again over the past week from 476 to 455 for the week ending September 10th. Our BioBot wastewater surveillance showed the number of virus particles stayed level over the past week. The 7-day rolling average of hospitalizations decreased from 39 last week to 33 today. We encourage people to follow the public health recommendations posted at covid19.lincoln.ne.gov, which includes staying up to date on COVID-19 vaccinations, wearing a mask and getting tested if you have symptoms, and please stay home if you're sick. We'll continue to monitor our local situation closely and the level of impact on our community. If we see significant changes, we'll be back with another briefing to keep everyone informed. And with that, I'd be happy to take any questions. Okay. Well, thank you for joining us today.